So just as people are joining, and apologies to those who have heard this before, I'm Ed Hughes. I'm the Chief Executive at the Council of Deans of Health, and just want to welcome you all to this afternoon's webinar, which is looking at all our health resources and how we can deploy those in universities. And it's great to have so many of you on the call today. Just to let you know, we are recording this webinar, so it will be available on the Council of Deans YouTube channel and elsewhere afterwards. So if colleagues who aren't here want to have a look at it, then they'll be able to see it there as well. So do let them know if there are people who would like to be here who can't, then they can have a second chance at catching up on all of this. And I think we'll get going now, a couple of minutes after the start time, and numbers seem to be stabilising. Welcome everybody to this webinar from the Council of Deans of Health, and I'm now going to invite our speakers to introduce themselves before we go into presentations and Q&A. And just to ask everybody in the session, there is a Q&A function in the Zoom, so do use that if you've got questions for the group or questions for individual speakers, and we'll have some time at the end to pick those up. But now I will just quickly introduce colleagues. So first of all, Jamie.
Yeah, good afternoon, Ed. Good afternoon, colleagues. I'm Jamie Waterall. I'm currently heading up the Chief Public Health Nurse Office in the Department of Health and Social Care, and in this context, I'm also the National Director for the All Our Health programme.
Great, thanks, Jamie. Catherine.
Hi, afternoon, everybody. My name's Catherine. I'm an Associate Professor at the University of Nottingham, and this afternoon I'm going to be giving a little bit of insight into our BSc Health Promotion and Public Health programme and how we've integrated the All Our Health with some examples of programmes across our school as well.
Great, thank you. Lizzie.
Hi, my name's Lizzie Eat. I'm a lecturer in nursing at the University of Hull, and I'm going to be talking this afternoon a little bit about how we implemented all our health resources primarily across the undergraduate nursing cohorts over the last few years.
Great, thanks, Lizzie. And last but not least, Rebecca.
Hi, thank you. I'm Bex Reynolds. I'm Associate Head of School for Teaching and Learning at the University of Plymouth, and I'll be talking about how we've integrated these resources over quite a few years into our pre-registration nursing programmes.
Great, thank you. So as you can hear, colleagues are going to be able to give some really good examples from different institutions and different perspectives on how the All Our Health resources have been integrated into programmes and used to support delivery of programmes in the HE sector. So hopefully this will be really interesting for colleagues, and please do, just say, put your questions and comments in the Q&A in the chat. But without further ado, I'll hand over to Jamie, who's going to kick us off. So Jamie, over to you, please.
Perfect, thanks. So hopefully the slides can come up, and I'll just start with my first slide, which kind of sets the context that Ed and colleagues have already said around what we're trying to achieve this afternoon, and that's to be able to share with you some really important resources under a programme called All Our Health, which is a programme we've been running for a number of years now, which came and initiated, or the genesis of this was coming from that insight that if we want, which is even more topical currently right now politically, if we want a prevention first system, if we want a system that very much focuses on public health and prevention, we need to support the health and care workforce to have the right knowledge and skills and competency to be able to achieve and deliver against that ambition. And so for a number of years, we've been working with public health experts, with kind of colleagues at the top of their field in terms of various public health issues to bring together some bite-sized learning that can be used both in this context, in curricula, in kind of undergraduate, postgraduate courses, but also with the wider workforce. So next slide, please. So as I've said, it feels, public health is the focus on public health and population health has been around for quite some time, but the current kind of political and strategic context feels like this places this even more importantly. Currently, we've got a government that's saying it wants 3 major shifts over the course of the next 10 years, and that's how we move from acute to community, how we move from analog to digital, and then very much in this context, how we move from treating disease to preventing disease. And so I think we've probably all recognised, colleagues on this call, colleagues that will be presenting to you, that there's a real opportunity to supporting the workforce to kind of further their knowledge and their confidence in this space. So we've currently got the development of the 10-year health plan, of which I'm sure we're going to see as that develops over the course of the next few weeks and months, that there will be a very strong focus here on all things prevention and public health. We've obviously got the government's health mission, again, which is making a major strong focus on how we go more upstream and focus on the prevention of disease, and particularly also thinking about how we address deep-rooted health inequalities that we know continue to exist are a major challenge for our system. And if we consider it in the context that we've got over 3 million people that work across our health and care system, but both in health and in care, and that they are the most trusted workforce of any in society, having millions of contacts with people, the public, each and every day, whether that's working at an individual, but sometimes community or population level, then there's a real opportunity to better kind of engage and utilize that workforce to really drive that focus and improvement around prevention. And clearly the political framing here around how we create a workforce which will support the development of a fairer Britain, where everyone lives well for longer. Next slide, please. So All Our Health, as I said, this is a program we've been developing for a number of years now. Came from that insight that we commissioned some qualitative research a number of years back, and we were asking the health and care workforce across settings in acute, community, and in wider public health roles, what was it they needed to support them to take up that challenge around the greater focus on all things public health, how we kind of supported them. And what came across really clear from those original insights was, one, there wasn't one single place to go to get kind of easy accessible information. That there were resources out there, but actually having something that is really clear and concise, and recognizing that lots of colleagues don't have a huge amount of time, but they were very keen to learn about public health issues, but wanted it in a concise and easily accessible way, alongside equally thinking about how we position this alongside making every contact count, which is more of that kind of individual kind of focused one-to-one kind of input where we do brief intervention, but All Our Health actually going above the kind of MEC approach to thinking more about knowledge, skills, confidence around the issues, and not necessarily just thinking about things from an individual level, but also thinking about how we might approach these public health challenges from a population, societal policy kind of policy way. Next slide, please. So over the course of the last few years, we've actually ended up generating quite a number of modules, ranging from the typical kind of areas you would imagine. So some of the most popular, most launched content is around obesity. So we've got a module on adult obesity, on childhood obesity, through to probably less typical or topical kind of issues. So a couple of years ago, we introduced a new resource on financial well-being. This is something we've been really trying to champion, because I personally and professionally strongly believe that we as health and care professionals do need to consider the importance of the wider determinants on health, and particularly financial well-being is a really good example of that. Doesn't necessarily mean to say that all professionals need to be financial experts, but certainly where we recognise where financial well-being is impacting on people's health and well-being, how do we best kind of support and typically make referral to other services like Citizens Advice Bureau or other sectors that can support people in that context. One of the very other popular modules here is the Health Inequalities resource. So clearly, again, we've seen that growing interest and recognition that we all have a role to play in addressing inequalities. And so that module's become particularly very, very popular. And obviously there's a number of resources really trying to take a life course approach from thinking about children, babies, children, young people, right through to the work we've got here on healthy aging, for example. Next slide, please. So you can access the modules in different ways, but the primary way that we kind of share the content is through our relationship with the e-learning for healthcare platform. So on e-learning for healthcare, you can access all of these modules, and they all take a common approach. So, and this was based on the insights we got for what people felt was most important and what would be most helpful to them. So each of the modules will look at why does it matter? So looking at the evidence base, looking at the statistics and the kind of public health data and evidence to tell us why that public health kind of particular issue kind of has importance, and why do we need to be addressing this. I suppose the areas that we see most people engaging with is the what can I do to help? So that then looks at, well, if I'm a frontline health and care professional, or I'm a professional working in a strategic context, managing or developing services, what can we do? What are the things that we need to be considering to address, whether it's obesity or smoking tobacco or some of the big public health issues like physical inactivity. So what can I do to help? Where can I get more information? And again, people find this really helpful. So is there NICE guidance? Are there other resources that are particularly helpful in that particular area, and signposting people to other resources? And then finally, there's an optional knowledge check. So people can undertake a brief knowledge check to see whether or not they are understanding the content of which they've just been reviewing. As I said, mainly on the e-learning for healthcare platform, but you can access plain text versions of these. So the other thing we learned quite early on was different people will want to access the content in different modes. So if they're embarking on some learning and development, then people are quite keen to use the e-learning platform. I think if people are just quickly wanting to go and grab some content or look for some information, they'll go on to the gov.uk kind of pages. And I think I'll talk more about the social care. Oh no, I think it might be the only time it's here. So the other thing we've just done is we recognised last year that the content perhaps is perceived more for being for the healthcare workforce rather than the social care workforce. And so we set up an expert advisory group with the social care sector, who advised that we should develop a module that specifically targets adult social care. So earlier last year, we published the social care resource, which takes a kind of 10 tips approach to what does public health mean for social care, but very much using social care language framing and using examples and case studies that are relevant to that sector. Next slide, please. So just to show you, we're making some progress in terms of people engaging and launching the content. So I think actually with the latest data, this is data looking over the last several years and the last financial year data, I don't think we're too far off actually having over or near to 3 million launches of the content. That said, given that we have 3 million health and care professionals working across the system, then we know we need to get a lot better at engaging both undergrad, postgrad, and ongoing professional development opportunities to embed and share this learning. And that's why this webinar is so important for us. But you can see from the data here, we have been seeing a gradual increase. We kind of dipped again last year, but the people are accessing kind of both the gov.uk content, also content through the e-learning for healthcare platform. And then the AICC probably won't get too much into this, but there is opportunities, and particularly those from kind of higher education institutions. You can syndicate the content onto your own platform. So there is a means of syndication. That's what the AICC bit is. So you can actually, in all purpose, kind of have it embedded on your own platforms rather than having to go through to other kind of the main index pages on e-learning for healthcare. So next slide, and I think I'm almost done. So just wanted to share, to give some confidence around us kind of recognizing the content is working. And so we did this pre and post survey. We did match propensity scoring, where we were looking at those individuals that had undertaken or pre-learning, kind of looking at their knowledge, competence, intention to act, and the usefulness of the resource that we just literally launched on health disparities, inequalities. And we were really pleased to see statistically significant improvements in all 4 measures post-learning, particularly where colleagues felt that it was absolutely increasing their knowledge, their competence, intention to act, and 70% of participants feeling that the module was both useful and relevant to their practice, and would recommend it to other colleagues. Next slide, please. So I'm going to leave this bit to our colleagues that are going to talk next, because I think they're going to give you the examples about how to embed this within your own organizations. But just a real plea to kind of post this session, do go and look at the resources. If you want to approach any of our speakers about kind of any further content and learning on how they've approached this themselves. But the main kind of aim is how we can get this better shared, particularly across HEIs, and embedded into your own content. But Ed, I'm going to leave it there and hand over to colleagues.
Great, thanks very much, Jamie. And I'm handing over to Catherine now. There were a couple of questions in the Q&A, Jamie, for you, I think, which we'll come back to at the end of the session, but just to prime you to have a look at those, if you wouldn't mind. And there are some questions in the chat about sharing slides, and my assumption is that we will be able to share these slides after the session. If there are any adaptations anybody needs to make, we can come back to that, but hopefully we'll be able to share most of the slides and links after the session, but Felix maybe can come back to us on that in a moment. Great, I'll hand over to Catherine.
Okay, thank you very much, and good afternoon, everybody. So I'm going to skip 2 slides because Jamie's touched on the sort of policy drivers, and move straight on to a little bit of an overview about the undergraduate health promotion and public health degree. So whoever's flicking my slides, can they go to the next one after that, please? Because obviously Jamie set the scene as to where we're at with looking at the prevention agenda. So what came out of that, and it took a few years to get going, and then we had the pandemic in the middle, but finally we launched 2 years ago our first undergraduate health promotion and public health degree at the University of Nottingham, and we're delighted that our 2nd-year students are progressing well and are halfway through the course already. So it's about recognising, and I've just made some quick notes there about, you know, health promotion and public health occurs often outside of NHS organisations. So this is looking at shoring up our workforce going forward to look at how do we get graduates that are able to work around this prevention agenda, both looking at individual communities and populations. And our whole of our curriculum embeds the ethos around the wider determinants of health. And I'll touch briefly on placements shortly, but it's really interesting that our students have come into this course with very, very diverse interests in prevention agenda, which does really reflect the all our health topics. So, you know, they're not nursing students, they're not on a clinical program, but they're going to graduate and they're going to be working at the coal face, if you like, of prevention. And hopefully with the changes to recent policy, they're going to be addressing some of the challenges we face going forward in with the sort of health of our populations. So just on to the next slide. Thank you. Little bit about the course. We were delighted that we've got programme recognition from our colleagues in the Institute of Health Promotion and Education. And what we did when we developed the curriculum was we mapped it to the UK Public Health Register standards, because anyone that's got experience of working in health promotion and public health is, if you're not from a clinical background, it's quite difficult to get the recognition about where is your professional standing. So this course is got the recognition to give it some kudos. Our students, when they've been working, once they've graduated for 2 years in public health roles, however diverse they may be, they can use the transcripts from our programme to apply to go on to the UK Public Health Register. So a bit of a sales pitch, you know, our colleagues are experts in their field. We've got people from sexual health, HIV background. We've got people with global experience in public health, physical activity. I myself worked, whilst I'm a nurse, I worked as a health promotion specialist for 10 years in Nottingham, involved with smoking cessation services, teenage pregnancy, etc. So we've got our theory and research, but we've also got our sort of working experience, and we've got great networks with our local providers working in, you know, often the roles are in the voluntary sector, and I'm delighted Jamie said about social care. You know, we need to get all our health resources available to a broad range of professionals beyond the NHS. So, you know, a lot of the people we work with are from the sort of voluntary sector. And tonight, a colleague and I are going to a pub quiz in a pub in Nottingham, where they're going to be doing, you know, activities with populations in that environment. And, you know, that's taken it out of the sort of traditional settings. We've got a global profile in public health at the University of Nottingham, and we're delighted to offer students a placement in the second year. So just moving on to the next slide, a little bit about how we've embedded these. Well, we've tried to embed in nursing, and I know that I've met with Lizzie previously about that, and that's working well. But obviously it's been a gift for us in this programme, because these students are really invested in the sort of the prevention agenda. So a couple of real life examples in my module in year 1. It's an introduction to health promotion and public health, and as part of their assignment they choose a topic they're interested in, and then I signpost them to all of the resources on the All Our Health platform. And you know, they've chosen really diverse ones. I know it's not available at the minute, but last year a student used the County Lines tool. That was her assignment. She was really interested in county lines as an issue, whereas another student looked at air pollution. So with that broad range is a gift to our students. And then in year 3, I'm really interested in social media, and you know, I'm trying to catch up with AI, but looking at a safe platform for messaging, because again, it's about where do we get our messaging from, and obviously All Our Health, which is great across all the programs, is consistent. So when you use them, they look the same, they're trustworthy, because your first view is the same, whatever the topic is. And I think that does give it a real sort of status, and people recognize it as trustworthy information. So beyond my program, I am, and as Jamie knows, been sort of from the beginning, a real sort of trying to trailblaze these in nursing and programs running across the School of Health Science. So one example that I can give beyond the health promotion public health program, if we go to the next slide, is some teaching we've done on our sports rehabilitation program, where I was talking a little bit around health promotion approaches in rehabilitation, and the students are all thinking, well, all of our students are really resulting from sports injury, but talking very much about force prevention, strength-based exercises, thinking about the sort of aging population and getting them to think of sports rehabilitation in that concept, and signposting them to things like the health inequalities package, which reflects all of their disciplines. They need to be thinking about why might people not get to their service. So those students have really engaged with it. And in nursing, in year 2, we run a psychosocial health module and we embed these into that module. And again, when students are looking at their assignment, you know, we say these offer you a way in to get really great references and further reading on some very interesting topics. Also within physiotherapy, we look at physical activity for public health. So, you know, my pitch really going forward, and again, I've just made some notes, is around thinking wider. So on our health promotion and public health programme, our modules are open to students across the whole university because we haven't got that restriction because we've got professional body requirements like nursing might have. So we've got students from the liberal arts that are doing our modules. We've got students that have done it from sociology, psychology. So again, it's thinking, how do we get them right across the university? Because I've just made a few notes thinking about the built environment and housing. Some of our students are going for placement with local housing departments because that fits around this agenda. So thinking about a bit broader than just our perhaps health focused courses, and how do we get them across the whole of the university is a really exciting prospect going forward. And again, just go on to the next slide, it's thinking about the sort of policy around the core 20+5 agenda about health inequalities. And I think if we look at the priority areas and then map them to how you could look at that using your all our health resources, you know, smoking cessation is a really good example. So if somebody wants to focus on smoking cessation across those aspects, the all our health platform would allow them to access financial package, the smoking cessation resources, the children and families. So you could use that as your example, but actually use all of those resources to support your own learning and development. Next slide, please. So what we want to do, and I think across both our healthcare and our health promotion and public health programs, is look at what we're delivering educationally and the skills we're giving our graduates so that they do recognise those wider determinants of health, and that we realise that health is, you know, looking at beyond our traditional healthcare providers, beyond those NHS settings, if you like, and thinking much more of those sort of wider determinants. And a little bit very briefly about the placements some of our students from the health promotion programme are going to is the integrated care boards. They're looking at sort of hopefully some work with Notts County Foundation and looking at voluntary sector. So, you know, looking at organisations like Framework, which are working with homeless populations, but they're not an NHS health provider. So I think, again, it's how do we not only make our health promotion and public health students aware of that, but how do I make my nursing students aware of that as well? How do we make our physiotherapy students and sports rehab students and midwives think beyond those traditional settings? And I think the All Our Health platform captures that. You know, Jamie showed the slide of all the topics, and I think it captures the diversity and where we need to be thinking that our workforce is best placed to look at the primary prevention and secondary to prevention rather than the very reactive way we're working currently. And I think that's my, oh yes, a lovely little quote from one of our health promotion students who has got a real interest in environmental issues. Hopefully is going to have a placement with the Rivers Trust and the air pollution topic. He came into the course not quite sure, not really sure about the sort of very more clinical focused issues, because he really is really passionate about public health and the environment. And again, we're all living the issues of flooding, fires, etc. So he found the air pollution topic a real nice introduction to that sort of as something he's got an interest in, and hopefully when he graduates that will sort of have given him the stepping stone, and some great evaluation there from that learning package. Thank you.
Fantastic. Thank you very much, Catherine, and really useful insight into how you're using those resources. And following on from that, we're going to hand over to Lizzie, who's going to talk about their experience at the University of Hull. So, Lizzie.
Hi, good afternoon, and yeah, thank you for inviting me to share some of our experiences from the University of Hull over the last few years, where we have really tried to work hard at, I want to say the word exploiting all our health resources. That always seems like quite a negative connotation to it, but actually, you know, really embracing that whole suite of resources on the All Our Health platform and bringing them to better attention of our students. So if we just go on to the next slide, I'm going to use a bit of Jasper reflection here for you academic types. What we did originally, and this happened actually before I joined the project, is my colleague, Vicky Hewson, she doesn't work with the university now, but she made some really good links with Jamie and the team in the Office for Health Improvement and Disparities. And as a result of that, we became aware of the All Our Health resources, and we could see immediately how much scope there was to work at introducing our student group to those resources. So primarily, as I'm talking, I'm going to be talking about what we did mostly with our undergraduate BSc nursing students, and the reason that they were sort of identified as the primary I want to say victim, I'm going into all this terminology, but the primary cohorts for our attention around All Our Health was because they're such big cohorts of students. So going back 4 or 5 years, we're talking cohorts of between 200 and 300 students. So we knew we could have the biggest impact most quickly. Now, at the time that we first started using the All Our Health resources, we were still using a nursing curriculum that was based on some old NMC standards for education for nurses and midwives. And the work that we started to do with OHID coincided with the new development of a curriculum for the undergraduate nurses based on the NMC code and the standards that were evolved in around 2018. So we were really quite fortunate in terms of our timing, that we had an opportunity to review our curriculum, it had health promotion and public health vaguely touched upon in many of the modules that our student nurses looked at, but it was never fully addressed. And as a health visitor coming into higher education, I was always looking for opportunities to insert public health messages and health promotion messages. And it was very, very difficult for colleagues to see perhaps its importance or its relevance. With the new curriculum, it became embedded just so much more deeply because of the new NMC standards for proficiencies for nurses. So because we had those links with OHID, we were in a really good position to bring in a few different members of programme teams from across our faculty. So primarily it was within the nursing groups, but we also worked with colleagues in nutrition and dietetics, in the ODP team, and in the paramedic sciences team. And by finding the right colleagues with an interest in public health and health promotion, you hit upon a real goldmine of energy, because many of us felt the same, that up until now we haven't had as much opportunity to introduce health promotion to our students as perhaps we would have liked to. So there was a real willingness amongst ourselves as kind of health promotion people, really, as well as teachers and educators. So at the same time as that, we identified some student champions, and we kind of drafted a student champion role descriptor, and there was a lot of eagerness from students to get involved with things that are kind of extra curriculum that exploited their particular interest in health promotion. We get many students coming from quite extensive variety of working backgrounds themselves, so they've worked in healthcare, and some of them bring with them specialist knowledge and interest. So straight away, a handful of students were really keen to come on board with the All Our Health material because it connected with some of their career experience to date. And having those student champions was really important, because the student groups themselves could see that they had peers amongst them who were talking this language around health promotion and demystifying public health and health promotion, because I think there's a lot of assumption amongst healthcare students and even amongst qualified practitioners and healthcare people and professionals as to their understanding of what public health is and what health promotion actually is. I think it's traditionally been seen as a standalone activity that is a role that belongs to other people. and having a peer group of students helping our student cohort understand that it is becoming everybody's role was really, really important in that move towards spreading the word in a way. And so alongside this, we were also having to keep up to date with the ever-growing All Out Health material, because it's been growing quite exponentially over the last few years as well. So if we move on to the next slide, what all this meant was that we gained a real momentum over the last 5 years, looking at how each year we can build on the students' experience of being exposed to All Our Health material right from their first year. So when we're talking about our nursing students, we're talking about introducing them to the All Our Health material in one of their first modules in their first year. And again, this coincided with the development of the new curriculum. So we based one of our modules on the platform 2, so in the NMC standards of proficiency for registered nurses. There are 7 platforms in which we want all future nurses to have the skills and competencies associated with that, and promoting health and preventing ill health is platform 2. So this just gave us this amazing gift of being able to develop a whole module around health promotion, public health and illness prevention essentially. So again, just timing wise, it was very fortunate. COVID did come along and it could have scuppered our plans. We didn't let it. It gave us an opportunity to use online resources and online teaching to exploit, again, those links with an online platform. And the students really embraced that, as we did as a teaching team, because we were looking for resources that we could include in our online teaching in a much more straightforward way. So COVID was very inconvenient for everyone, but actually in terms of All Our Health, I think it gave us a big boost, because it provided us with a solution to some of our teaching, which was just wonderful. And as has been said already by Jamie and Catherine, those resources are really accessible, they're really wide-ranging and diverse in terms of what they cover. So as our nursing students move through their programme of study, there is literally something within that suite of resources that speaks to whatever topics they're talking about. Because the nursing curriculum is still quite treatment focused in terms of how nurses manage care, plan and manage care and deliver treatments and care to their patients and clients. But the great thing is there's a lot of those resources on the All Our Health platform that do speak directly to individual conditions, for example, cardiovascular disease. So we kept the momentum going. We brought more colleagues on board in terms of our working group. So we looked at bringing in people from some of the new programs that we were developing around physiotherapy, for example. And everybody was really keen to start to understand about how we can message our future workforce about the prevention first agenda, essentially, because I think everybody has got a very good grasp of how crucial that is to the functioning of our NHS in years to come, and the health and well-being of our populations. So the next slide, please. So now what do we do next? Well, thinking ahead, we are really keen to maintain our relationships with OHID and obviously the other HEIs like Nottingham and Plymouth that we've been collaborating with. We want to continue that collaboration. There's so much opportunity to do evaluative type work now and to look at where this all goes. We want to work harder at rewarding our student champions and the student groups that get really involved in the All Our Health material. And, you know, the first year, just as an example, we did evaluate All Our Health at the first year that it was delivered through the Promoting Health and Preventing Ill Health module. We had feedback similar, I'm sure, to the other HEIs, with students telling us that they themselves had quit smoking, that they themselves had started doing Couch to 5K, and I became a member of a WhatsApp group where we were all doing park runs together. This is myself and a group of students. So remembering the size of our nursing cohorts, or actually our communities within higher education, they are our community as well as our communities and patients and clients that we're working with as a workforce. So in terms of inspiring them to make changes in their own and their family lives, as well as those of their patients and service users, is actually very significant as well. So yeah, we want to make sure students still are brought into this, and one of the ways that we do that is, again, at the end of the Promoting Health and Preventing Ill Health module for these students in their first year, after they've been assessed on their poster for that particular module, they're invited to enter a poster competition, which Jamie very kindly judges for us. And it's an extracurricular activity that allows students to really celebrate the work that they've put into an assessed module, but really, really draws their attention onto the importance of health promotion and illness prevention, and the role that nurses and future nurses play in that agenda. It's part of our professional role and responsibility, and it's outlined in our code, and the students are really grasping that now and wanting to celebrate that rather than just see it as another thing they've got to do. So the other thing that we're looking towards doing as well is working much more closely with our local provider services, and starting to collaborate and cascade out some of our learning to local provider services, and share some of the ideas as to how we can encourage clinicians to start to access these resources, so that when students go out into clinical practice, they can share the conversations with current practicing clinicians, but also those clinicians can then obviously cascade that knowledge and the information to the people that need it, which are our communities, our patients and our service users. So for us, it's been a really exciting time, and it's just grown and grown and grown. I guess my concern is that at the moment I'm very accessible. I am part of the work that went around the toolkit and things like that. So I'm a named person, as are some of the other people on the call. And I worry about, well, I'm not planning to leave the University of Hull anytime soon, but what happens when I do? It's how do we in higher education embed these projects into our curriculum in such a way that it's not dependent on key staff. And so that's something we're still trying to resolve here in the University of Hull. I'm sure it's something that you face elsewhere, and not just in relation to health promotion and public health. It's any of these agendas. It very commonly takes one or two people to keep driving them forward. And what happens when those people leave? So I think it is about getting this embedded in curriculum, because once a module leader adopts the curriculum for their particular programme, it comes through, it gets pulled through year on year. So I think that's really, really important. I think that's me done. I don't think I've got another slide. So back over to you guys. Thanks, Ed.
Super. Thanks very much, Lizzie. And without further ado, I'll pass on to Bex, who will be our last contributor, and then we'll have some time for some questions. So over to you, Bex.
Thank you, Ed. So on to the next slide, please. Thank you. I thought I'd start off with a bit of a timeline, because we've been working with the All Our Health resources for quite some time. Back in 2019, I was introduced to the tools as part of a pilot using Twitter as a learning platform. So we did some work back then with the platform, and we had some existing learning for our first years as part of our assessed module, and we actually had the opportunity then to use that as a learning platform. The students really enjoyed it. So the following year, which was when COVID, so that's when everyone had to think quite differently about how we were integrating our learning, and actually we had the opportunity to use that platform again to support what we were doing with our students. So the same as Lizzie, with our pre-registration nurses, we actually have a module that is promoting health and preventing ill health based on the NMC platforms. This was, we were able to embed that into the module quite quickly and easily, using the resources, and also alongside that using the asynchronous learning that was available on the Twitter platform. The success of using that has meant that we've gone on to continue to use that now, and we've built in student workbooks to support their learning, which all links to the resources. The assignment for the module is very much built around them identifying a contemporary public health issue, and then actually thinking about what is the role of the nurse in relation to this. And these resources are absolutely invaluable for the students to be able to look at, access some of what these current issues are, and then actually sort of drill down and see what they can actually do, because it actually directs them to what a health professional can do and other different roles. So it's been really very, very helpful for that. And then we've also done some other work around piloting other e-learning packages, and I've had the opportunity to share that more broadly with our Faculty of Health, and been able to develop more sort of asynchronous learning activities to support our pre-registration nursing curriculum. I then went on to do a bit of a research project with our local placement providers and with our pre-registration children's nurses, and look at how we could support them better in practice. And so then I actually went on to develop an online toolkit, just using a Xerti platform that was just for our students, but it had lots of links to very relevant topics that they could access on the All Our Health e-learning platform. And I also got the embedded wider into our pre-registration nursing by it being available as one of our recommended e-learning packages for students that they could do for simulated practice. So all the time encouraging them to think about those links between what they're learning and how they will apply it. So rather than it being a standalone module, a lot of work has gone on over the sort of following years to make that sort of more apparent across the programme, because at the moment they're doing the health promotion module in the second year, so obviously want them to start thinking about that right from the beginning. So that's our opportunity to do that. If you want to go on to the next slide, that's just an example of the toolkit that was able to put together that students can now access whenever they go out into practice, and it just gives them some key signposting as well as other resources, but lots of key signposting of what kinds of topics they might want to access, and that's available to their practice assessors and supervisors so they can see, and it does encourage everyone to be looking at the same resources. And I did get that published a couple of years ago, so there's some more information if people did want to read a bit more about that particular project. So if we go on to the next slide, I'm still the module lead for our pre-registration health promotion module, which is brilliant, but those resources are very much embedded now. We have a poster presentation very similar to Lizzie actually for our assignment, and it encourages the students to identify that key contemporary issue. And one of the benefits of the All Our Health resources is they can go on there and they are the contemporary public health issues of the time, which is really useful for them. And one of the other things that's really helps get them started and very much a springboard for their work is they can actually go on and see links to the actual current live documents, and it just saves some of that confusion that sometimes happens when students are trying to find out what's the relevant policy for this, why do we do it this way. It starts to answer some of those questions. And while we say it's not the answer to their complete piece of work, I always encourage students to start there and start to have a look and pick out some of the subjects that interest them, and then start to read the original resources that have informed that learning platform, because actually then they are getting to understand a bit more why we are doing things. But what it does offer is a really nice condensed easy access start for them in their learning. As I said, we've maintained the resources as simulated practice as well, and we use the resources in our seminars to guide them to them when they're actually building some of the activities. So we do things like design a healthy community as one of our seminar activities, and we guide them to those resources. We get them to think about what are some of the key issues, and I get them to work together in groups and identify things that might surprise them and look at some of the data, and it just helps them get started on that journey when they're not too sure about accessing some of that raw data, which can be really daunting for students when they're starting out on that public health journey. And we also, I also do some interprofessional learning amongst other other schools within our Faculty of Health, and it's really great to be able to introduce them to some of those resources, particularly around things like health inequalities, and get them to have a look at those and sort of have a better understanding, a broader understanding of the communities that they're working with, that they may not have that opportunity in their specific subject that they're studying. Okay, next slide, please. One of the big things that's great from all of this is actually the student feedback. And this is some old feedback, but it's still very, very relevant. And Lizzie said some very similar comments. These are some of the things that students have said about the impact that it's had, and actually the impact it's had on themselves. One of the key themes that I think is coming through is we're doing quite a lot of research around the well-being of our own students at the moment, and what really is coming through is actually students aren't very good at looking after themselves, and actually this has been a real key opportunity for them to think about their own health and well-being, and actually what we empowering them to have a little bit more information and a little bit more understanding, so that they might be able to make some choices that work out better for them, or access more information, or access the right support. So yeah, reading through some of those, it's just been really powerful to see what difference it has made to have that understanding, and get everyone on the same page and thinking the same things and understanding having the same sort of ideas about that. Okay, and just onto my last slide, I think. Probably whizzing through. Yeah, and just to summarize, it really has been a very positive journey. I have had the advantage of being the module lead. I have now recently taken on the role of Associate Head of School for Teaching and Learning, and have the opportunity to review our pre-registration nursing curriculum. And I'm really excited to think about how we can actually look at that more as a strong thread running through, particularly with the current driver for more prevention focus. So it's a really exciting opportunity to think about how we can make that a stronger thread all the way through. But it really has been so easy to use, and it has felt like a really solid resource that we can just use as a real strong, solid foundation to scaffold the students' learning. It's such a great starting point. It really does apply so well to practice, and we can use it in our classrooms, and we can get them to access it while they're out in practice to make a difference. And then hopefully, using that in practice is actually encouraging others to do the same. So they are just at the beginning of that learning journey, but actually they will know how to access them and how to use them going forward. And I think that's it really. It has been mainly very positive for us. Thank you. That's the end of mine.
Great. Thank you so much, Bex. That was really great. And we've just got a few minutes left for questions. So first of all, I'd just like to thank all of the contributors. It's been really interesting to hear the different ways in which you've approached integrating the All Our Health resources into the curriculum, and also some of the similarities and some of the similar outcomes that we've seen, and might come back to that in a moment in the questions. I'm going to start with a kind of pulling together of a few questions that came in when you were speaking, Jamie, about, I suppose, areas that the All Our Health resources might not yet cover, or might cover in the future, or that perhaps colleagues have noticed might be missing. So particularly around resources to support vision and eye care, ophthalmology, about pathology services, and about special prescribing and creative health. And maybe just use that as a springboard for plans for future areas, and think about those particular areas as well.
Yeah, thanks, Ed, and colleagues. Thank you for the questions in relation to the how we evolve and develop the content. Yeah, it's always challenging, because there will always no doubt be kind of a desire or request to add new content, and one of the things we're just trying to carefully manage is that we don't oversaturate the platform with too much content. And equally, how do we almost taking a public health approach, we've got quite a strict criteria where we look at things like to what extent does that particular issue affect something called DALY's, disability adjusted life years lost. So what's the big impact in terms of morbidity, mortality, you know, so it's one we're constantly keeping under review. Always welcome recommendations. I think one of the things that we're looking at for this year is having now published the social care resource, it's made us kind of just question. We don't have a general introduction to public health on the platform as it currently is. We immediately go into topics. So it's, you know, obesity, smoking, physical activity, healthy aging. So we're just testing and exploring the idea of, should we develop an overarching, what is public health? And what's the principles, and particularly thinking about the 3 Ps around prevention, protection, promotion, and inequalities, and what does it all mean? So we're looking at that. And then another area that's been muted, and we'll just have to kind of explore, but there's a lot of people asking for a module on gambling harm. I think we're seeing gambling harm coming up the agenda quite considerably. So but anybody has any suggestions, please do share them.
Great, thanks, Jamie. Ophthalmology is getting a lot of quite reasonably a lot of mentions in the chat and the Q&A as well. So maybe one to think about there. There's a question that was put around the accessibility of the e-learning for health resources for university colleagues as well as healthcare professionals. And I suppose one of my reflections on what I've heard today is about how useful the resources have been for students themselves, thinking about their own health and promoting their own health, and whether how this could be used in university and other communities where there are students and staff together who would benefit from access to these resources, and indeed could be incorporated into courses that aren't about healthcare but are related to other subjects where the students themselves might benefit for their own health. And I don't know whether anybody wants to pick that up.
Just quickly, and maybe other colleagues have comment, but we purposely made all of the modules open access, so you can access them via a registered platform with e-learning for healthcare, but you don't have to. And so we have purposely created the content that anybody can access this wherever you are. You can access. So they are predominantly for health and care professionals, but anybody can use them. And we recognise that if we, as you've just described, Ed, the wider workforce out there all has a public health role to play to some degree or another, and so they are accessible. I did see that in the chat, and anybody can access this content.
Looks like
Great. Thanks, Jamie. I don't know whether colleagues can hear me at the moment, but anybody else got anything to?
Oh no.
I think Catherine, I might just come back. Have I just come back?
Catherine, you go for it. I was going to add something, but Catherine, you.
No, I think it was, but just building on what I said in the presentation, we're delighted that we've got relationships with the liberal arts and, housing that sits in our sort of social policy, and it also sits in the, engineering. So I think it's really about quite exciting that they are that wider accessibility is really important. I think we have to is e-learning for health, so you just have to say don't worry about that, and just look at the ones that you might need to signpost people to. But I think that's really important because it isn't, like I keep saying, it isn't just about those traditional settings. So I think colleagues using them from a university wide perspective would be great. But right. I think it's a challenge that engagement. So I think it is, we have to sort of really trailblaze that ourselves.
Yeah, thanks, Catherine. Lizzie, did you want to come in on that?
Yeah, only to kind of add to what Catherine just said, that there is so much scope across a university. You would argue that many of the resources, particularly the core modules around inequality and about air pollution, and yeah, they're relevant to everybody, not just healthcare professionals or future healthcare professionals. I guess for me, the thing that springs to mind is about being realistic, that there's a lot of work to do within, when I speak for Hull University, my own faculty of health, and trying to spread that out across the social care practitioners as well. So it's kind of pace yourself in a way, because you could feel so ambitious about where you want to take it, because there is so much scope. But I suppose we've just got to start off and kind of pace ourselves as well, just and give ourselves permission to do that.
Right, yeah, thanks. Completely agree, Lizzie, and that's really helpful. I'm conscious we're coming to the end of our allotted time, so want to wrap up by saying thank you again to all of our speakers. Really informative session. There's a feedback poll that's come up just now, so colleagues who've been on the webinar, please do give us a rating for that. That'd be really helpful. And we'll be sending around the slides, and as I said earlier on, this session will be on our YouTube channel as well, so colleagues who haven't had a chance to see it will be able to view it there as well. And apologies to those questions we didn't get around to answering. We'll see if there's a way of maybe capturing some of that in the feedback that we send around the group afterwards as well. So thanks again, and just from the Council of Dean's point perspective, thank you to the speakers, but also thank you to Jamie and the team at All Our Health. We're supporting them and trying to disseminate these resources across the HE sector, and we'll continue to work with Jamie and the team and with others to make sure that these resources get widely used and recognised across the HE sector and beyond. So thanks for that, and thanks again for joining the session.
Thank you.
Thank you.